Hello again. This is Dr. John Malik here at the Beloved Medicine Clinic, and this is our second video in the diabetes education series. We are going to talk about um, diabetes type 2 today. People ask me, what is diabetes type 2? We already explained diabetes type 1. We're gonna go over diabetes type 2 today. And basically, diabetes type 2 is the diabetes that gets diagnosed when you're a little bit older, like in your maybe 20s or late 20s, most likely in your 30s/40s. And in this type, remember how we talked about the diabetes type 1, you had no insulin or very little insulin. Now you have insulin in your body, but it's not working. Why? Because you have something called insulin resistance. That means if, for the sake just of the analogy, if you need 1 unit of insulin to decrease your sugar by 50 points, in the case of diabetes type 2, you probably need 2 or 3 units to do the same job. Just for the sake of the analogy, not really. That means that your body is fighting back the insulin. So the idea of treating type 2, either to provide more insulin or decrease your resistance to the insulin. There are many things that we go over for the treatment, and we can explain that, but let's explain again how the function of the body works with the insulin resistance. And why do we develop insulin resistance? Insulin resistance most commonly caused by obesity, like we're overweight or obese. We define that by usually obesity, BMI greater than 35, and non-diabetics. Once you're diabetic already, the obesity, the BMI is greater than 30. And BMI is body mass index, which is basically your weight in kilograms over your height in meters square. Of course, this doesn't happen over time. It doesn't happen instantly, but happens over time. And the genetic component for type 2 is way more than type 1. Type 1 is barely there is any genetic component. People usually think that type 1 is the genetic one. Actually, it is type 2. So, why do I need more insulin, and how to overcome the insulin resistance? We provide either medication that squeeze the cells of the pancreas that produce more insulin, or work on the fat cells and the muscle cells and other cells in the body to increase their ability to take in insulin medication. Sometimes some of those medication will work on the kidney to get rid of more glucose. Some of the other medication will concentrate on the brain to decrease the craving for more sugar, because normally when the sugar goes high in the circulation, your sugar is high, but you're not able to take it into your brain and other cells, so the brain feels what we call the craving. Okay. There are many ways, and we'll go over the different medication in another video, but for now we're gonna be focusing on that diabetes usually does not come alone. It comes with other problems. We already mentioned one, which is the obesity. The one that most commonly and almost inadvertently comes with diabetes is hypercholesterolemia. The body tends to accumulate more cholesterol on the blood vessel inner surface, leading to possible clogging, and eventually, and unfortunately, those vessels, especially in the vital organs, can get clogged and closed, leading to heart attacks, strokes, peripheral vascular disease, and others. The deadly combination usually, and I'm sorry to say this word, but the deadly combination, if you have diabetes, cholesterol that comes with it, and you're smoking. Can I do anything about it? Yes, we will talk about that in another video later. But the one thing, if you're a smoker today, yes, you can start on cutting down on smoking, eventually stopping smoking. More details to come in the following videos. Thank you.